Any changes in the world of dental implants?
Randy, a lot of changes. And we're no longer using just regular dental x-rays to plan our dental implant procedures. With regular x-rays, we can only see the bone in 2 dimensions. And that usually involved making large incisions and a lot of downtime. And today, with the CAT scan, I can see the bone in 3 dimensions and even inside the bone. And what I use is a software that I virtually plan the entire implant case from start to finish, because I know where the tooth needs to be, and I know what the bone structure is, and it allows me to do a total planning of the case before we ever start. And what that does is allows us to do the implant surgery with no incisions and no stitches, and really it's no downtime.
So not all dentists are doing it this way.
No, most dentists are doing
nationwide, they're not. Some of them are just using dental x-ray?
Most are still using traditional dental x-rays.
Is that right?
Yeah, the CAT scan is certainly a new technology that the dentists are now learning to use, but I've been using it for several years now.
Should a patient demand that from their dentist? I mean, if they're going to be doing dental implants, what do they say?
Well, I think, in my opinion, that they should be using CAT scans. The difference is like driving your car with a blindfold on without the CAT scan.
Okay.
It's that different. I want to know all the details about that bone structure before we ever start the case. So the planning is critical in those cases.
So it's all about
a huge advantage to the patients. They can go back to work the same day. I mean, it really takes the fear out of having that procedure done for our patients.
You say you could do this in a day?
Absolutely.
How?
And even in an hour. While they're at the grocery store or the supermarket, I can completely plan their dental implant procedure, and we have very precise guides that I use, such as this, that goes right over the gums.
What am I looking at there?
This is a surgical guide for a patient that once had dentures, and we're going to put 6 implants in that lower jaw, and I'm going to use this, and this was done using the virtual planning. This is going to go right over the gums, and I'm going to use this surgical guide to deliver their implants to the jaw, and then the teeth can be put on the same day or the following day.
How soon can they eat?
They can eat immediately after the surgery.
What about pain? Because when I think of dental implants, it seems
it's scary for a lot of
people. The patients complain about pain?
No, not with this new procedure. Most of them take just one Advil or Tylenol, and literally they could go back to work or their daily.
And that's new. I mean, that's fairly new.
That's very new.
Not a lot of guys doing it?
Not a lot. Not a lot. I've been doing it for several years because I was part of the inception.
So you teach that procedure?
I teach this to dentists, yes.
So what do you call it? Like flapless? It's not. You're not cutting.
It's a no flap, no incision dental implant placement. So it's called guided surgeries.